Hello, so I wanted to go over the blood vessels in the rest of the body. If you haven't seen my video on the cardiovascular, the circulation of the heart, then watch that first because that kind of covers your jumping off point there. But now we're going to go outside of the heart and go into all of the arteries that go all along the rest of the body. And then another video, I'll go back and we'll do the veins. Okay, so first of all, here's your heart. I know it's not really shaped like that, and we need to get a big head up here so I can fit what I'm going to draw. And the thumb goes on the outside, remember anatomical position. And I'm making really fat limbs because we need it for to be able to write these arteries in here. So here we go. There's the neck, here's the shoulder, the thumb goes on the outside because of anatomical position. Obviously this is the anterior position of a person. So the first thing we want to go over is the beginning of all of this. The first place that the blood comes out of, washed and scrubbed and reoxygenated and everything, and red blood, is where it's going to come out of the heart. And it's going to come out of the heart through the aorta. And this little section that goes up, see it goes up, that's called the ascending aorta. So ascending aorta. And then this is going to arc around, and that's going to be called the aortic arch. It's the same vessel. It's a really big fat vessel too. It's the same vessel, but it just changes names a little bit because we changed positions of it. So that's going to be called the aortic arch. And the blood, of course, is going down this way because arteries always away. These are arteries. Arteries always away from the heart. The arteries always carry blood away from the heart. So on this aortic arch, there's going to be three vessels that come off of the aortic arch. This big fat one here that's leaning to that side, this skinny one, and this skinny one. And we'll get to those in a minute, what those do and where those go. But let's pick up back here from the aortic arch. The aorta just continues to go down, 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 down through the thorax. And here's where like the diaphragm would be. So when the descending aorta, this is called the descending aorta because it is descending. It's going down. And the descending aorta has two subnames. One is the thoracic aorta, and that's this section, the part of the aorta that's in the thorax, in the thoracic cavity. And then there's the abdominal aorta. And that's the aorta down here that's in the abdominal cavity. And so we'll get to the rest of that in a little bit. Let's go back up here, up to these top three arteries that veer off, that pop off of the aortic arch up here near your sternum, up above your heart. So there's this big fat one that veers off to the patient's right, to the right. And the reason why, and it's because it's so fat, it's not even called an artery, it's called a trunk. And that is called the, let's see, where's a good place to write this? The brachiocephalic trunk. And then there's two pointing off to the patient's left. This middle one right here goes up to the head, and this is called the common carotid. And since it's common just means it shares a bloodstream with two different arteries. So in other words, that means it's going to split off into two different carotid arteries. One's going to go inside the brain, and the other one's going to stay outside, kind of near the superficial surface of the head, and give the blood supply to all of that. So this is the external carotid, and this one would be the internal. Now this next one, this third one going off to the left, off of the aortic arch, this is called the subclavian. Okay, I'm going to write this down here. The subclavian. And when you look at the model, you want to be able to denote right or left. So this would be the patient's left subclavian. And why is it called the subclavian? Because what bone in the body is right here at the shoulders, right here, that goes from your neck to your shoulders right there? That's right, that's the collarbone, that's the clavicle. So that's why the artery that goes past the clavicle is called the subclavian, because it goes right underneath the clavicle, subclavian. And then the subclavian artery continues down through the arm. But just like a street, like the streets in St. Louis, sometimes you drive past a block and the street name is changed into something else. And just like that, as soon as the blood flows through the subclavian, but it gets to under the arm, to the armpit, then it's called the axillary, because axillary just means armpit. As soon as it's done, as soon as it's gone past the armpit and it goes down the top of your arm, this is called the brachial. Because remember, brachii means arm, and you'll learn that in learning your muscles. Brachii means arm or upper arm. So this is the brachial artery. Now, as soon as we get to the elbows, like here's the elbows right here. As soon as we get to the elbows, the brachial artery splits into two, and one goes down your pinky side, and the other crosses over and goes down your thumb side. Now, what bone is on your thumb side? What bone is right here? Your radius, right? So this is your radial artery. And what bone is on your pinky side? That's right, the ulna. So this is your ulnar artery. And then it loop-de-loops around in the hand. And I don't think you need to know the names of those. If you do, you can always look them up. But it just does this loop-de-loop around in the palm. Okay, now that was the left side of the arm there. But why is it asymmetrical? It should be symmetrical, right? It should have the exact same things on the right side as the left side. Well, that it does, and that's all because of this brachiocephalic trunk here. Yeah, outline this. This brachiocephalic trunk. It's just a very short piece of an artery, and it's very fat. That's why they call it a trunk. But off of this, you see how over here on the left-hand side of the patient, two main arteries come off, the common carotid and the subclavian. Well, those two arteries come off of the brachiocephalic trunk. So here's the common carotid, and again it splits into the internal and external. That's the carotid artery, common carotid, and then it splits off into the internal and the external. And then right next to it is the subclavian, and it goes right past the clavicle, just like your other subclavian did on the other side of on the left side of the patient. And just like the subclavian on the other side, it goes through and right around that armpit area. Once it gets to this armpit area right here, that's going to be called the axillary artery. And then once it's done passing the armpit area, the axillary area, it's going to go down your upper arm, and that's going to be the brachial. And then it's going to split in half again, just like the other side. This is no different than the other side. And one half is going to go down toward the thumb side, and the other half is going to go down toward the pinky side. Now, what bone is near your pinky? Your ulna. So this is going to be your ulnar artery. And what bone is near your thumb side? Your radius. So this is going to be your radial artery. So that's about does it for the top half of your person, of the main arteries in your body. It's really no more complicated than that. Once I get into the bone room, I'll take a video of me going through the model and showing it on the model, but it's really the same thing. If you can remember this, and if you can draw this out from memory, then you should have no problems finding it on the model or on your diagrams when you take the test, okay? If you have any questions about this, leave a comment or send me an email. And don't forget to subscribe to the YouTube tutorial channel, Suzanne's Tutoring. And I'm going to do, the next video is going to be on the abdominal aorta down here, the abdominal aorta, and then down to the legs. I'm going to do that next video.